All right, Dave, so we've already kind of checked everything out, and I want to talk a little bit about treatment options now, right? So one option to try to help things feel a little bit better, move a little bit better, is a manipulation. So I want to talk to you about what manipulations are not, what they are, and then some of the good stuff that it does for us. So first off, manipulations are not magically putting anything back into place, taking anything out of place. They're essentially a quick stretch. And with that quick stretch, we may or may not hear or feel a pop. What we find is that if we do, cool. If we don't, cool. It's essentially the quick stretch. It's not the pop that makes the difference, okay? So what does a manipulation do for us? Well, it essentially does some good stuff at the joints that we're actually trying to treat. It does some good stuff at the spinal cord, and then also does some good stuff up at the brain. So with that quick stretch, we find that the joints themselves move a little bit more, and then with that moving a little bit more, they can feel a little bit better, move a little bit better, and that's both at the joint that we're treating and then also at kind of the adjacent joints, the joints around it, okay? At the spinal cord, we find that when we do that quick stretch, we actually get a little bit less of kind of these danger signals being sent from the area that's kind of a little bit uncomfortable. Less of these danger signals traveling up through the spinal cord to go towards the brain. So it kind of blocks those signals from moving up. We also find that if we have some muscle tightness, like muscle spasm around the area that hurts, the manipulation actually helps to reduce the amount of muscle spasm that we have. And then we also find that kind of paired with that reduction in muscle spasm or tightness, we actually have a better control of muscles in our arms and our legs, and then also better control of some of the muscles in our back. And then up in the brain does some cool stuff with that manipulation. We find that there's a change in blood flow to the areas of the brain that process pain, so it helps to calm down those areas that process pain. It also helps to access our brain's medicine cabinet, where it causes a release of some of our brain's pain medications to help reduce pain, and then also sends a signal from our brain down to the rest of our body to help reduce the amount of pain that we perceive, the amount of pain that we feel. So bottom line is, it does some nice quick stretch, does some cool stuff at the joints, at the spinal cord, and up in the brain, and that can help change the way that we experience pain. Do you have any questions? Awesome.